Good evening, y'all. My name is Kay Jeter, and I will be presenting my pitch presentation for our final week. Well, I am going to introduce you to my storyboard with Mr. and Mrs. Phillips. They were one of our patients, and just seeing and dealing with patients on a daily basis. Patients are coming into our health care facility and just being anxious and nervous along with their health issues that they already, have because they have to make a visit to our facility. So we as healthcare providers want to help our patients with that. So, they already have enough stress on them when they are being seen here, and whatever else they may encounter. So, for example, they might already have worries about their finances, the results of their tests, their diagnosis. That's already on them. And with us working with them, if we make their lives easier, during their time spent here at our facility, that'll help them, kind of ease their pain and their, stress level. So it'll be up to our team members to take part in helping our patients and their families as they pay, a visit to our facility. And then how we're going to solve this solution. We as healthcare providers will follow our policy, procedures, and the facility's vision, mission, and values. So without that, there's nothing really for staff members to go by. So we want to be able to have something for them to follow. Like at our facility, we have something called the 4Ps, and that is a guideline for all the team members, to follow, and they have to follow it and sign their name to it that they've followed it, read it, and will abide by it. So that's, one thing that we hold our team members accountable, is by doing that, and with all the trainings and putting out there our new policy and procedures, and we create those as issues occur, so, and these are some of the issues that we've noticed, lately at our facility. So we would just want to make sure how to help the patients overcome the issues that they may have. So, with the outcomes, after many meetings and trainings with all the team members, that we found that we have had a much positive patient survey, according to the people that sent us our surveys from the patients. We found that our survey kind of climbed up, instead of going down, so which is a positive for us. That means we're doing something right. And also speaking with the patient and their families in person while they are here, and just finding out, what their needs are, and allowing them to be open with us, and, feel free to ask us questions or any concerns that they may have. So this really opened up our eyes and ears to see, see everything from the patient's point of view, and, like the old saying, hear it from the horse's mouth, as they say. So we're going to continue with that, and if any other things that may arise along with my piloting, we will change it as needed or add anything that we need, as we go. So I created my roadmap as well, and that's where my roadmap took me. So I'm going to follow that through and see how the whole year goes, and then whatever, whenever we meet, we're going to look back and see, okay, this is what we did, and this was the outcome. Okay, what do we have to change to make our process work? So, and next I went into the resources that were needed. I used, the resources that needed to be accommodating to the patients and their family. We have what's called a lavender room, which is designated for the patient and their family members. And that seemed to be working because it's really relaxing, and, the light is dim, and they have comfortable recliners and, sofas in there to actually, for family members to be able to read and, pray or do whatever they need to do that'll help, calm their nerves and help preventing them from being anxious for their family members that are being cared for here at our facility. So we also have the chaplain services. We have people that work with as the chaplain. They're on call, so if we need them, we page them and they're here, and within a set amount of time, and how urgency each case is. So, and also they have the chapel to utilize as well. So if the chaplain service is not available for whatever reason, the patient and their family can go into the chapel and utilize that, and pray and meditate and do what they need to do to help them become calm and be able to rationalize with whatever situation that they're going through. And then also, we as the team member, we are working at the physicians when they explain the procedures and diagnosis to the patient. They need to actually, kind of talk in layman terms so that the patient understands. And that kind of, oh, okay, I see what you're saying, doctor, such and such. And then also have some empathy, and towards the patient. And not just tell them, abruptly, this is your issue, this is your case, and walk right out. At least give them a chance to ask any questions and let the information simmer in, into their minds and thoughts and see, okay, I'm being diagnosed with cancer. What do I do next? What's the outcome? The first question that's going to come to their mind is, when am I going to die? Especially everybody hearing the word cancer. It is, very common nowadays for whatever reason. So, just be understanding. And then with all that, we also have trainings for the physicians, the nurses, the CNAs, and we're going to expand the training into, our radiology department as well as our transport, and these are the people that transport the patients. It's okay to have a conversation while you're pushing the patient to X-ray or MRI procedures. So we're kind of going to run this pilot through the whole hospital, and each manager is going to be responsible for all their staff getting trained, signed off, and then we will be emailing those rosters to the chief of nursing. So, and then lastly, as far as our request for the audience, to participate through volunteer, supporting, funding, collaboration part, as I continue to provide quality care, to our patients and service to our patients, and the facility will need to continue to have patients fill out the surveys, and that'll be able to help us with what we need to do and what we need to fix, or what we need to add or take away, what we need to do with our team members, and we'll handle it, according to each issue that may arise. And also we'll see if we can start a survey while the patient is here in our facility, and that way we can handle the situation at hand, because that's how you're going to get your patient referrals, because you don't want a patient leaving your facility upset and not wanting to return, or bad mouthing your facility. So you want a positive outcome with that. Also providers also provide for team members to voice their concerns with the managers and our team members regarding any issues that that they may see, with the patient or the patient's family, what plan they want to do to assist the patient to better accommodate their needs. Because again, we have to remember also that we have our non-compliant patients, our more, hard to deal with patients that no matter what you do, they're not happy, So we have to always, take that into consideration, as well as being in the healthcare. You never, you never always have a satisfied patient after every single visit. But the main, important thing is that you will have some that will be a positive visit, and that's the ones we want to thrive on, along with the negative, so that way we can see, if there's anything else that we can do to help, provide what we need to provide for them. So, and that concludes my presentation, and I hope everybody enjoys it. Thank you.